And I understand you've just had a hip replacement around 10 weeks ago.
I think it was 10 or 11 weeks ago, yes. I had a full right hip replacement.
And that was done at the Runnymede?
It was done at the Runnymede under the auspices of Mr. Monk, the surgeon, and very successfully.
Brilliant. And tell us a little bit about your condition before you had the operation.
Well, I'm probably quite fortunate that I didn't suffer huge degrees of pain, but my hip was 100% arthritic, and everybody kept telling me I should be in a lot of pain, but I think I'd managed to sort of half block it out. But it restricted my mobility. I was struggling to walk up and down stairs, couldn't walk around a golf course, couldn't play tennis, and most of all, I couldn't get on my motorbike.
That was becoming difficult or almost impossible.
Absolutely, could not do it at all. I could stay on the bike for about 3 minutes before I started to yelp. It was then getting very painful. It's funny how just different movements would suddenly really start to hurt. Well, I'd been to my doctor. He'd batted me into the NHS version of, or adjoining Runnymede, the Runnymede Hospital, St Peter's, but I hadn't done anything about it. So I then decided that I wanted it to be done when I wanted it to be done. So I've had private medicine for a long time. So I researched it and came up with Mr. Monk. Then I went to meet him. He found him to be very charming and reassuring individual who had done numerous operations, did so many a week, all the things you're supposed to try and find out. And he seemed to tick all the boxes, so I agreed it with him, and we agreed a date, and that was about it, really.
And then, so post-operatively, you've back to playing golf, I understand already.
Yes, I walked around St George's Hills Golf Club last week, and I was exhausted, but the leg was perfect. It was absolutely fine. I would like to say something as well. Sorry. Pre the operation, I was very worried about going in for this, really did not want to do this at all. And Mr. Monk said to me he wanted it done under a spinal anaesthetic, not an epidural, as the anaesthetist pointed out to me. And I said, no, I want to be unconscious. And they talked me into the spinal anaesthetic with a heavy sedative. And the last thing I remember was saying to the anaesthetist, don't send me into the operating table, I'm still awake. And the next thing was Mr. Monk waking me up. And it really was as easy as that. And I so regret not having it done a year or two earlier, or possibly even 3 or 4 years earlier. I was told to anticipate full recovery within 6 months, 6 to 12 months. Walking without crutches after 6 to 8 weeks. Lots of physio, etc., etc. And I was walking without crutches after a week. I'd virtually stopped the painkillers after 3 weeks. Occasionally I'd have one, but generally it didn't hurt. Didn't hurt when I was walking. But my recovery was unbelievably quick. I mean, I went to the Runnymede for the physiotherapy session. I'd arrived before the physiotherapist, and she said I'd walk into my room, which I got up and walked into the room, and she said, well, you can go, there's no point, there's nothing I can do to help you, you're walking perfectly. It went, and my expectations were just, I couldn't understand why I'd worried so much. And I really mean that. And I had worried.